This new infant, a baby girl born to Depoa Dekhoa, has not yet been named. In the mountain kingdom of Lesotho, babies are only given a name several days after they are born. Dekhoa gave birth to her daughter at the Dikatsi clinic in Lesotho's capital city, Maseru. Lesotho is a small country bordered on all sides by South Africa. The country's health system has suffered the burden of limited funds, poor management, and demand that far outstrips supply. Dikatsi Clinic is one of 3 filter clinics bringing better services to the people of Maseru district. This network is part of an innovative public-private partnership between the government of Lesotho and the Tsepong consortium, which is headed by Netcare, a leading healthcare provider in South Africa.
We noted that the government was paying annually about 100 million maluti, but it was processing about 1,000 patients a day. And we went to the private sector and said, if we gave you 100 million, what quality of care, the range of services would you give us for that amount? And that's where the discussions began.
The World Bank and the International Finance Corporation have supported the government in the design of the partnership.
So the private-public partnership hospital in Lesotho is one of the most innovative health projects and activities we see on the continent. It is just exciting to see how, without really adding the public expenditure, you are able to deliver so much more value for money for the Basotho, for the people, for those patients who need hospital care.
Healthcare providers already working at the new clinics are impressed with the new facilities, equipment, and management. Sister Nzama is a veteran nurse midwife with 20 years of experience. She recently joined Tsepong after 19 years working for the government of Lesotho.
The lives of the patient has changed a lot. When you first see a patient coming in, being very ill, you do all what you can with what you have, and at the end you see the patient walking home with the head up straight, or with subsequent visits, you see the life of the patient improving. That makes me feel good.
The first time I came here, I was treated very nicely because I had something on my leg, and they took care, and then they x-rayed me. It didn't took me long to come here, and it didn't took me long to get a treatment, so it's much better compared to other clinics.
Besides Dikatsi, 2 other filter clinics, Mabote and Kwadeng, serve as primary care stations for between 300 and 500 patients daily. These clinics, together with Lesotho's newest hospital, which opened in October 2011, will ultimately serve about 500,000 people in Maseru district.
The facility is 425 beds large. It has 8 operating theatres and 1 minor operating theatre.
The new hospital and its 3 filter clinics is set to transform healthcare in Lesotho, especially for women and children.
Like today I saw 2 patients with eclampsia, pre-eclampsia, because that if it's not managed properly, it might go into convulsion. But we were able to do most of the basic investigation required, the urine analysis, the blood pressure, we are monitored accurately.
Lesotho's new public-private partnership for healthcare is a good example of what countries in Africa can do to make faster progress on their own health goals. Progress is helping bring modern health services to Lesotho's citizens.